Thank you, everyone, especially Professor Azad, Dr. Lalit sir, everyone for inviting me, and Abhinav as well. So I'm going to, it's the overview and the best diagnostic tool managing everything will be, speaking by other speakers. So what I'll do is I'll just go through epidemiology in the SAARC region as well as overview of So, financial disclosure nil. I'm from Tilyanga Institute of Ophthalmology, Kathmandu, Nepal. So, diabetes mellitus is a leading cause of morbidity worldwide. Prevalence is increasing, especially in low and middle income countries, especially in the SAARC countries. It's not going. Okay. The prevalence of diabetes is estimated to be 4.4 into 2030. And as the urban population is increasing, and especially more than 65 years of age is increasing, so that is definitely the change. List of countries with highest number of estimated cases. India is being the largest one, China, US, Indonesia, Pakistan, Brazil, Bangladesh, Japan, Philippines, and Egypt, it's in a row. So the important vascular complication of diabetes, of course, diabetes retinopathy is the fifth leading cause of blindness worldwide, although it's the preventable condition. It affects the vision of 2.6 million people in the world and responsible for nearly 0.84 millions of 32.4 million people. Diabetic macular edema, which is our main topic now, is a leading vision-threatening form of diabetic retinopathy affecting around 21 million people worldwide. It's the most common cause of visual loss in type 2 diabetes and may affect patients with diabetes. My slide's not moving. My slides are stuck.
Can you go back and then come again?
If you go to the lower side of the slide on the left side, there's an arrow. Yeah, press this. Yeah, this, yeah.
Yes. Diabetic macular edema, it is the thickening caused by accumulation of intraretinal fluid, mainly in the inner and outer plexum layer, result of hyperpermeability of retinal vasculature. And it can happen at any level of diabetic retinopathy. According to ETDRS, clinical significant macular edema, CSME, which we call as, it's a retinal thickening at or around 500 micron or 1/3 disc diameter of center of the macula. Hard exudates within 500 micron of the center, and retinal thickening greater than 1 disc diameter, in which within the 1 disc diameter area from the center of the macula. According to Wilkinson epidemiology study of diabetic retinopathy, it's in a type 1 over 10 years period, it's 20.1%, type 2 25.4% in group taking insulin, and nearly 14 in group not taking insulin. And prevalence of macular edema increases with 3% within 5 years of diagnosis to 28% after 20 years of duration of type 2. And according to DCCT, it's 27% of type 1 diabetes patients develop macular edema within 9 years of diabetic onset. So this is the overall prevalence of diabetes, prevalence of diabetic retinopathy, and prevalence of diabetic macular edema, taken from different references, which is going to be presented at the end. So if we start from these, there are 8 SAARC countries. Afghanistan.
Panelist link this is
12.1 nearly this is Afghanistan, 12.13%, 1.4% of diabetic retinopathy, and prevalence of DME is not known. Bangladesh, it's the 8% diabetes, 33% of diabetic retinopathy, and there is a large population-based study, and where I think Dr. Deepak Nag, which is one of the panelists, is co-author of this article. There's 34.1% in Chittagong Eye Infirmary, 5.4% in Ferry Diabetic Health Center, 30.3% in National Eye Institute. Bhutan, 8.2% of diabetes, prevalence of diabetes is not known, and prevalence of DME is also not known. India being the largest of all, prevalence of diabetes is nearly 12%, and the diabetic retinopathy ranges from 17.6 to 28.2, and prevalence of DME is 29%. Maldives is 9.2%. However, the prevalence of diabetic retinopathy and DME is not known. Nepal, our country, it's 8.5%. It's again from the population-based study. 23.8% prevalence of diabetic retinopathy, 4.2% of DME. In Pakistan, 17.1% diabetes, 28.78 DR, and in NPDR it is about 15.50, nearly 50%, and DME in PDR is nearly 5%. Sri Lanka, 8% diabetes, 27.4 diabetic retinopathy, and 5.3% of macular edema. So these are all from the population-based. This large population has been taken and this cross-section study. So briefly in review briefly about the diabetic. There are different classifications. It's mainly our aim is to help for the management of diabetic retinopathy. It could be central involved, central not involved, classified according to focal when it is caused by microaneurysm, which tend to leak fluid, and diffuse when there is a dilated capillaries in the retina causing diffuse edema after fovea. There are foveal FFA-based angiogram. There's a OCT classic-based angiogram. OCT-based classification of diabetic macular edema. There are different classifications, but our main aim is to treat and manage diabetic macular edema within the SAARC region. Risk factors, according to Wilkinson epidemiology study, it's high level of glycosylated hemoglobin, severity of retinopathy in both young and old onset female, and increased diastolic blood pressure in older age group. Systemic factors, duration of diabetes, age above 40, systolic blood pressure, high HbA1c, anemia, increased serum cholesterol, and obesity. And the main ocular factor associated with DME is severity of diabetic retinopathy. How to reduce the burden? Early detection, accurate diagnosis, timely treatment, and comprehensive program for the detection and management of diabetes is needed to decrease the incidence of complications. So these are my references for all those, accumulated SAARC incidence and prevalence of diabetic macular edema. And this is on